In today's video, I'm going to be demonstrating an acupuncture examination using Acugraph software, and then we're going to perform an acupuncture treatment so you can see what that looks like. For the Acugraph examination, what we're going to do is we're going to be measuring 6 points in the left wrist, 6 points in the other wrist, and then 12 points in the feet and ankle. And that's going to measure on the graph here how well the patient's energy is flowing throughout the meridians. So we're going to start here in the lung meridian. Okay. This does not cause any discomfort. Patient doesn't feel anything. And this is going to measure on the graph for us how the patient's different acupuncture channels are functioning. We do this acupuncture examination at each visit so we can chart your progress, and then we can see from visit to visit how well the patient is responding. Switch hands with that probe. Now we're going to measure the other side here. We're going to go palm up to start. And what's great is that we can see from visit to visit the patient's responding, things are improving, and on the graph visually the patient can see what is changing. And I'll show you the graph when we're finished here, and it's going to really show us differences between the different channels. And then it's also going to provide some recommendations for treatment that we can do to help the patient with her symptoms. It's one of the ways that we can objectify what's going on with the patient and see improvement from visit to visit. All right, so now we're going to move down to the lower legs. And so we're going to measure 6 points in each foot. And what this is doing is it's sending electrical energy through the acupuncture channel and just measuring how well that energy is flowing throughout the channel. And in some cases, there may be excess energy, or in some cases, there may be deficient energy. In the graph there, it's going to show the excess energy is in the form of a red color, whereas the deficiency is going to be in the form of a blue color. The other differences we may notice is there may be a difference between the left side and right side. So for example, say if you had an injury on one side of your body, that may be restricting some energy in that channel on that one side. And so that's like an imbalance between the two sides, and there's treatment that we can do to help with that as well. This exam takes about 5 minutes to do. We do it again at each visit just to really check the progress and see from visit to visit how the patient's doing. Now it's going to have me remeasure any points that seemed out of the normal range compared to the other side, just so it can tell if I was doing the exam correctly. So I'm actually going to go back to this side here and recheck the lung meridian. Okay, the exam's complete. And now in the next part of the exam, I'm going to talk about what the patient's results showed and what we can do to help with her condition. Okay, now that we're finished graphing the patient, this is what's going to pull up on our Acugraph software. So you're going to see 6 bars on the left and 6 graph bars on the right. And what that represents is the upper body acupuncture channels and the lower body acupuncture channels. You'll see different colors here. The green represents normal, blue means there's a deficiency, red means there's an excess amount of energy in that channel, and purple means there's a split between the left and right side. So one side may be higher, one side may be lower, and that just indicates there's a split. So if we click on this red bladder channel, you can see this is the actual acupuncture channel starting in the low back, runs down the leg, and ends in the foot there. And it goes all the way up into the face. So we typically see this with people that are dealing with lower back pain, very common, sciatica radiating down the leg. So what we're trying to do with acupuncture is we're trying to normalize this channel, so we treat certain points along this leg and in the back that'll help to lower that red channel into that green level. And the same thing can be said for if we're trying to raise up this channel here. This is the triple energizer channel, and that's one of the points we measured in the wrist there. And there's certain points along this channel that if we treat, it can help to raise that into the green level. And then finally, the purple channel, again, there's a split between the left and right side. So what we're going to do is we're going to treat certain points along this channel that can help to normalize those into the green level, so both are at the same level. And that's all acupuncture is trying to do, is we're trying to normalize the body by using certain acupuncture points so that the body can function optimally. So one great thing about this software is it also provides our patient with information in regards to, okay, we measured those different acupuncture channels, now what does that mean? So if we look at, for example, the pericardium channel here, some of the symptoms that you could be associated with that are shortness of breath, chest pressure, inability to speak, digestion problems, weakness, pain or swelling, stiffness in the chest, rib cage, underarm, shoulder, arm, or hand. Now you may not experience all these symptoms, but a lot of times there will be some relationship with that. For example, the pericardium channel is often associated with like mental or emotional issues. For example, like you may have depression or anxiety, so a lot of times that channel will be off because of that. And that's why acupuncture is great for treating depression and anxiety and stress, is it can help to, again, just calm the body down, allow the body to function optimally, and then you can feel normal again. The triple energizer channel, for example, the next one down was also blue. And with this one, when there's a deficiency in there, we may experience diarrhea, edema, digestion problems, or fatigue. Also, the weakness, pain, or swelling in the hand, arm, or elbow, or chest could also be the result of that. Now, this emotional component for this channel has to do with inability to freely express your emotions. So you'll see in each of the different channels, there's always an emotional component to Chinese medicine, and so there'll be maybe like anxiety issues or maybe like inability to freely express emotion in this case. If we scroll down here, the next channel that was deficient was the spleen channel, and this is often involved in digestion and just how that body functions down there. So the bloating, gas, poor appetite, vomiting, or diarrhea or constipation are all some of the symptoms you see with the spleen. Again, chronic fatigue, fibromyalgia, which is a common thing we treat in the office. Those are all issues that a lot of times arising in the spleen channel. Hormonal problems, menstrual disorders, genital disorders, often we see an issue with the spleen channel that's affecting those. And that's why acupuncture works so well for infertility, is again, it helps the body to function optimally. The next one down, the liver channel here, that one was there was a split between the left and right side. So one side may have had an injury and may not be functioning correctly on that channel. And there's certain points along that channel that we can treat that will help that body function correctly. If we go down to the bladder channel here, again, that was one we see a lot of times with lower back pain or sciatica. So we'll often treat those areas along those points there to help with relieve the back pain or help with the sciatica. But it's also involved in urinary or bowel disorders, which makes sense because of the bladder. Also, it could be stiffness in the shoulders. We see that a lot of times. Headaches and some knee disorders as well. The stomach channel is often involved in knee issues. It could also be dysfunction of the head, face, mouth, or teeth, and then weakness or pain or swelling in the lower leg there as well. So this gives you an idea. We print this out for patients. We also email that to patients each visit. So with each visit, they're going to get the results from this Acugraph exam, which is going to give a detailed exam about what's going on, and we can see from visit to visit how the patient is progressing. And then what will eventually happen is the patient's symptoms subside. We'll also see all of these will normalize into that green level. So it's great because patients can feel they're getting better, but they can actually see objectively that they're getting better. One other nice aspect of Acugraph is you'll see on the bottom here these numbers here, and that's basically what Acugraph recommends we treat in order to get this body in balance. So it's going to have different protocols that we're going to utilize to help get the body in balance. And this is kind of like our baseline. So we typically will do this first, get the body functioning correctly, and then we'll attack whatever the patient's coming in for, whether it be lower back pain, neck pain, headaches, or whether it be anxiety, stress, depression. There's a whole certain protocol that I'll utilize in addition to this, because what we find is once we get the body functioning better, then if we layer on top of that another treatment specifically for the patient, they're going to feel a lot better. And typically treatments take about a half an hour. Very relaxing. Patients often fall asleep while they're on the table. And we'll do this exam, each time, just so we can really check their progress from visit to visit. Okay, so now that we have the patient graphed, what we're going to do is we're going to do a treatment based on the graph and based on my findings. And so we're going to place a certain acupuncture needles in certain spots that correlate with the patient's graph and my exam findings. So what the patient's going to feel when we place the acupuncture needle in is just a gentle tap. A lot of times people think it's actually really painful. It's not. The patient barely feels anything when we put the acupuncture needle in. This is actually very relaxing, and a lot of times patients fall asleep on the table once we have the needles in. So we're going to place a few of the acupuncture needles in. All right, so I'm going to have you put your hand right there. So the first spot's going to be right there. Typically, a treatment lasts about 20 to 30 minutes, depending on the condition and what we're trying to achieve with the patient. I would say typically patients, we do a treatment protocol of about 5 visits, and then we'll reassess the patient and go from there. And that's typically for acute cases. For chronic conditions, sometimes anywhere from 8 to 10 visits is required, but it all really depends. What's great about acupuncture is not only can it treat back pain and neck pain, but it can also treat other conditions such as headaches, migraines, digestion problems, infertility, sinus problems, quite a few internal issues it can really work really well on. All right, and this time we're going to go palm up. There you go. How would you describe what it feels like from a patient's perspective?
I felt no pain. I could feel your fingers touching me, but I didn't feel any needle or pinch or anything.
Okay, great. Yeah, so basically the patient just feels me inserting, just doing a little tap, and that's about it. Now I'm also going to be doing some points in her ear, which is a type of treatment called auricular therapy, where basically there's a whole system of treating different points throughout the ear and the upper body there, and we're just going to treat certain points like that. Now we'll leave the needles in for about 15 to 30 minutes depending on the condition, and then we'll come back and we'll remove the needles. To schedule your Acugraph examination and acupuncture treatment, call my office at 703-912-7822 or visit us at novachirowellness.com to schedule an appointment online.